Hi, I'm Brenna, and I'm a therapist at Optimum Joy. I decided I wanted to become a counselor at about age 13. I was acquainted with grief at a really young age, and I was blessed to see how counseling was able to heal both me and my family members. After finishing undergrad, though, I wasn't really ready for more school, so I actually became a middle school Latin teacher for a few years until I went back and received my master's degree in addiction counseling. And when I finally got to step into the therapy room as a clinician for the first time, it felt like coming home. Probably my favorite thing about being a therapist is getting to see clients feel their feelings. I've worked at a residential facility where I've journeyed with women who are using anything to try to suppress their emotions, whether that's substance use, disordered eating, isolation, self-harm, anger. We'll do just about anything to not feel our feelings. And that creeps into our life, and it affects our relationships, it affects our sense of self, and it ultimately leads to us not living life as fully as we want to. Therapy is a time where you get to experience those emotions, and it's certainly not easy, but you're always going to have someone along the process to help you work through it and start to see if maybe you can find some coping skills to replace those old ones that can actually help you manage those emotions and live a more fulfilling life. Something that brings me joy is reading. I absolutely love to read fiction. I'm a big audiobook listener, and when I'm outside of the work setting, you'll probably find me sitting on my couch knitting or crocheting while I'm listening to an audiobook. I also love to learn new languages, and my dream is to one day be able to offer therapy services in the second language as well. Something I really enjoy doing in the therapy setting is helping my clients identify their values. I like to help them figure out what is most important to me and how are my current decisions, relationships, and behaviors maybe not honoring those values in the best way possible. Then we get to sort of explore what your life looks like, figure out what's most important to you, and help you guide your behavior and your decisions around those values in order to build that more meaningful life. One thing I want people to know about therapy is that your stuff is never too big or too small. You never have to worry that you're bringing too much to the table or have to justify coming to therapy. This is always going to be a safe space for you. I also want people to know that therapy is flexible. There is no one-size-fits-all approach, and if you're finding that something isn't working with the process, that's my job to help you figure out how can we change some things and reevaluate your goals and reevaluate what we're doing in the therapy room to make sure that we're accomplishing what you need out of your therapy sessions. I am open to seeing all kinds of clients from all ages, all populations. I love to work with a variety of clients on my caseload and to learn about your life and to figure out how to best serve you with what you're dealing with in your personal experience. Some of my favorite areas to work with are addictions, whether that's substance use or behavioral addictions like gambling and shopping, disordered eating and body image, and trauma. I've had the joy of working with all of these populations, including complex trauma and some of the personality disorders that develop as a result. I love incorporating dialectical behavioral therapy, which is a form of therapy that combines a non-judgmental worldview with really practical coping skills to help you address life in a way that works for you. I also really like to use narrative therapy, where we try to visualize your life as a story with you as the main character, and we kind of externalize the problems that are going on in your life so that they don't get all wrapped up in your identity. And we use that as an opportunity to see who you are, to see where your life is going, and to figure out how we might want to write the next chapter together. I also love to be able to offer a faith-based approach to any of my clients who are wanting that spiritual integration, whether that looks like exploring how religion may have affected your life, trying to figure out what non-religious spirituality might look like for you, or just trying to better understand how do you fit into the grand scheme of this world. I always take a strengths-based approach to therapy. I want to figure out what you're already good at and what's already going well in your life. Then we get to incorporate that into the healing process and harness those skills to tackle the hurdles that you're coming to therapy with. We're always going to celebrate your accomplishments and figure out a way to bring joy into the life you're already living.